right. I'm seeing everyone coming in and apologize for a little bit of the delay, making sure we had everything ready to go. Good afternoon. My name is Stephen Foster, and I'm the South Houston Market President for St. Luke's Health. I manage hospitals in Pasadena, Sugar Land, and Lake Jackson. I'm also the president of the Houston chapter, known as the National Association of Latino Healthcare Executives, Texas Gulf Region. I'd like to welcome our audience to tonight's program covering health policy. As you know, this has been a year full of challenges. Despite the pandemic, reforms and policies have continued to move forward, sometimes backwards and then forward again. If I were an outsider looking at the industry from afar, I might imagine a multi-ring circus with several death-defying feats happening at the same time in multiple rings. But I'm not an outsider, I'm an insider, and I know this is a focus that's important to all of us. So I hope you enjoy tonight's event. We have an amazing lineup that I'm sure you'll find interesting no matter what role you have. So bienvenidos. First, a little bit about NALHE. Our mission is to provide the chapter to connect and serve and support Latino, Latina, and multicultural healthcare leaders across the Gulf Coast region. We want to educate and advocate and promote diversity, inclusion, and health equities to better serve all of us in this region. Our vision is to be acknowledged locally and regionally as the point of reference for Latino and Latina multicultural healthcare leaders and professionals, early career students, and local industry experts in the community. I hope you can support our vision and mission. Also, a little bit more about us. If you're not a NALHE member, I ask you please take the moment and join by visiting www.nalhe.org. Then you just go to the chapters. It's located right at the top of that screen, and then you go and you select Texas Gulf Coast. Real easy to find us. And the membership is still being offered at $20 a year, so I think everybody can reach in there, probably in their couch, and find $20 to support a membership for the year. So I think we can all afford it. Each membership brings us closer to achieving our mission and vision, and the ability to provide great content like the program tonight. Want to send a shout out, a very respectful thank you to our silver sponsors for tonight's event. Cantax Continuing Care Network is committed to providing the highest level of innovative, compassionate, and quality health care services to yield optimum outcomes and value for the patients, families, team members, and the communities they serve. Dignity Global Education works towards a healthier future for all, driven by innovation, powered by humanity, where healthcare professionals are equipped with the skills, knowledge, and education they need to thrive in their roles and impact organizations they're in, and make a difference in the lives of others. So please join me in thanking our silver sponsors. I wanted to also update everyone that we do have a new board member. Yvette Shaw joined us about a month and a half ago. She works at Texas Children's, has over 25 years experience, and so look forward to seeing her leadership on the NALHE board. So please give her a round of applause. Finally, I'll end with the last slide before I turn it over to our host that I'll present here in a second. We do have a December event. It's going to be on December 15th at 6 p.m. It's a collaboration with NACI Houston and ACHE. And we're going to talk about DEI, diversity, equity, and inclusion. So I look forward to seeing you all participate in that. It should be a great, lively discussion on topics that are important to all of us. So with that, no further ado, let's go ahead and introduce our moderator for the night. Her name is Lila Foss. I have the privilege and honor of working with Lila. She actually attended a little bit about her. She attended the Lady of Our Lake University for her master's in business management. She's also a member of the American College of Healthcare Executives. She attended the University of Houston, got her degree in business and marketing. She's fluent in Spanish and Italian. She's currently attending Duke University for a certificate in innovation in healthcare management, and she's continuing to do her studies at Thunderbird as well. So she is very much an academician. She has more than 12 years of experience in healthcare leadership, in new business development strategies, practice management, and she's just a czar in anything to do with marketing and business development. So with no further ado, I'd like to introduce you to Lila. So Lila, are you on?
Yes, good evening, everyone. Thank you, Stephen, for the introduction. And thank you for having me tonight. We do have a very exciting topic, like Stephen mentioned, and I would like to share the objective of the program. The purpose of tonight's event is to bring awareness to health policy and different topics that are happening outside our scope, and bring education of what we can expect in the year of 2022. I'm sure a lot of us are waiting to see what's gonna happen. So let me introduce you to our two panelists for today. Our first distinguished panelist is Julian Rivera, and Julian is a health law partner at Hodge Blackwell. His services to clients include a diverse set of healthcare providers, DME companies, pharmacies, and health plans. We also have James Lee. James is a leader in multi-stage government relations with experience in cancer care and community health systems. He serves as a senior manager of state regulation and policy at the Community Oncology Alliance, headquartered in Washington, D.C. So I appreciate these two great speakers making the time tonight to talk to us. And please be aware, participants, that you can drop your questions in the Q&A section. So with that being said, please help me in welcoming our first speaker of the night. Go ahead, Julian.
Thank you very much. I'm really pleased to be here. My law firm has been working with NALHE National we sponsor it, but we're also working to have lawyers from our offices where there are NALHE chapters join and give whatever resources and support we can do. So this is a very important organization to us and to me. I grew up in El Paso and went to the University of Houston and Texas Tech Law School, and I did research at the Baylor College of Medicine and MD Anderson before I went to law school. After leaving law school, I went to work at the Board of Medical Examiners, and then I've been in private practice since then and involved with a number of different organizations. My focus is physician leadership and health technology, and I serve on the board of the Texas eHealth Alliance, a term that y'all are going to hear frequently tonight, or the name of a company you're going to hear frequently tonight. And what I'd like to do is go through with you their legislative recap, because it seems to me that, well, what do we know? In Texas, there is no such thing as giving money for technology to address healthcare disparities, to put it candidly. That is diversity and equity efforts labeled as such are perceived in a hostile way in our politics, particularly the Texas legislature. And so the wins in technology, the WINS in technology and healthcare technology and healthcare disparities, you have to dig for a little bit. And so what I'd like to do now is to share my screen, if that's all right. And can everybody see this digital health? I'm hoping you can see this digital health overview that is that was put together by the Texas eHealth Alliance. The Texas eHealth Alliance has done a great deal of work surveying all of the diversity, equity, and inclusion efforts in technology, specifically in Texas, and also looking at the federal level. But if we look here at the innovation section, and the very first bill is HB4, a low number, and a low number bill means a high level of importance. And this bill really changed a lot of things for health technology in Texas for the better. The bill directed HHSC to allow rural health clinics to serve as originating sites, distant sites, and during the provision of, or both, during the provision of telemedicine and telehealth. Before the pandemic, there were very limited locations. Essentially, a patient had to drive to some clinic that was designated an originating site and then link up with their provider. The pandemic wiped that out, and it allowed telemedicine to happen in the home. This was critically important to addressing healthcare disparities, and rural health clinics is kind of the focus of where those energies are, at least in Texas. What's important here is that this policy extends into the urban environment, and where we look at it is that a similar change was made for FQHCs, so the federally qualified health centers, in 2019. So we're looking at a progression. There are a number of different policy levers being pulled: Texas, federal, other states, professional, but these are trends that we can look to. The HHSC is to implement telemedicine and telehealth in any program under the commission's jurisdiction, as long as those services are cost effective and clinically effective. Examples of these are, Medicaid had a limited number of services that could be done through telemedicine. What the legislature is saying here is open it up, open it as wide as you can where it's cost effective. A really significant thing for healthcare disparities was the audio only benefits for behavioral health services as a permanent benefit, and a benefit that can be applied to other programs. The reason why this is important is that healthcare disparities follow, and there's an entanglement here, but where a healthcare technology desert exists, you have healthcare disparities. Where you have healthcare disparities, you can connect health technology disparities that match up to it. So we know that in communities with high levels of healthcare disparity, that video and not just audio is difficult to come by for a key reason, and that is because of the internet, the bandwidth for internet. We know that disparate communities, or communities receiving disparate levels of healthcare, don't have good internet access. And that wasn't something that the Texas legislature felt like they could really fix. And the reason is because of the politics of the correction that was in place or was starting to be in place, or they were trying to put in place at the federal level, which was put in place with the infrastructure bill. And so now what you can anticipate is that folks and areas and communities that did not have internet access are going to be, mapping is going to be critical in order for resources to go directly to the communities most in need. The coordination of that effort improved a lot during, particularly in the initial stages of COVID, but that's still going to be a piecemeal effort in many regards. Allowing Medicaid to reimburse providers for home telemonitoring was important, again, because folks who are high risk and isolated at home need to be able to or absolutely benefit from home telemonitoring services. The good news is that home telemonitoring services don't generally require the size of bandwidth that a video conference would require. And then to the point of, to my earlier point, the availability of telemedicine and telehealth has now been considered, can now be considered when networks, payer networks, are trying to prove adequacy for each of their communities. They can now prove adequacy with telemedicine and telehealth services. And this is important in communities where they don't have specialties and subspecialties live and in person, but the payer can bring in telemedicine specialties and subspecialties. So this allows them to get the credit for that, so to speak, and meet their regulatory requirements. In my view, this is one of the most important elements of change. And it seems odd, but text messaging is such an important tool, not just for emergencies, but for other critical reminders and well child checks. We know that in communities where there are healthcare disparities, that the number one method of communication and effort at compliance is through text. So to be able to make the Medicaid and CHIP program more facile with text is an important thing to get at the healthcare disparities. Teledentistry, which at first blush strikes folks as odd, but teledentistry allows for a dentist to see a patient via video, and the patient can have their dental hygienist can be at the location with the dental hygienist, and the dentist is coming in remotely to look at x-rays and to look at video of the patient's mouth. This was hotly contested, very, very political, a lot of different interests, and fundamentally, Texas, and it's been going on for a long time, Texas cleared this up. And again, this is an example of the kind of flexibility that is now available to get resources and services into communities that were otherwise isolated. Yet another opportunity, although this is a pilot and really just a study, is trying to get, they asked that MD Anderson Cancer Center and the Texas Medical Board get together and figure out how to set up a safe system for providing drugs for pain management or supported palliative care via telemedicine. There's currently legally that's barred This is trying to look at how telemedicine can be used to get those services out into the community while not making our opioid crisis worse, and in fact make it better. And then a program that Texas has been leading the way on for probably 10 years, and that is telehealth programs in public schools, particularly public schools that don't have full-time nurses on site at each campus. Given the nursing and workforce shortage, this is a really important and valuable tool. HB 5 was established a state broadband program with the necessary functions led by the comptroller to expand connectivity in Texas. And they created a dedicated fund for broadband initiatives and a grant and loan program to help broadband infrastructure. This initiative got significant funding. And the question is, how is this funding going to get out into the communities of need? And that's necessary not just for the delivery of healthcare, but also for the delivery of education in locations where education has to be supplemented or substituted with virtual teaching. So this is, so I share this with you because this gives you a sense of where change is going to happen in order to improve access to care. And fundamentally, as long as we have the struggle that without technology, without a community with technology, we can't bring effective technology solutions. That reality has to be fixed. And you see that Texas took some pretty big steps towards fixing that reality, but actually changing it and actually implementing, operationalizing these opportunities is the next challenge for payers, community, nonprofits, for providers. It's going to take a massive amount of collaborative effort in order to bring all of these disparate opportunities and all of these disparate challenges towards some sort of solution. So I'm happy to answer any questions, but I'll hand it over to James if there aren't any questions.
Thank you, Julian. Definitely interesting topic. I think when you mentioned the telemedicine and the payers can bring specialties and subspecialties, we see that at the hospitals all the time. And our physicians are able to offer virtual visits to our patients. So it's good to see that that's definitely in the queue on what you presented. I don't see any questions on our Q&A, so I will turn it in to James.
Cool. Hey, everybody. So I'm going to go ahead and share my screen. We're going to go over a few things. First, I just want to say thanks for having me. My name is James Lee. I'm based here in Houston, and I'm originally from the Rio Grande Valley, from Brownsville, Texas. I was born and raised on the border, moved to Houston to attend the University of Houston, go Cougs. And I have worked in community healthcare here in Houston, previously with Legacy Community Health for the past 7 years, and recently started working in multi-state government relations for a national association called the Community Oncology Alliance. And so that's a little bit about me. I'm going to talk to you about the Texas legislature and some of the policy that was passed. We'll go ahead and talk about, some issues specific to healthcare, some of the controversies that we saw throughout this past year, what they mean for Texans and what they specifically mean for us as healthcare professionals and specifically the Latino and Hispanic community. I'm going to go ahead and share my presentation, so bear with me one second. All right, could I just get a confirmation that y'all are seeing the presentation?
We can see it.
Great. All right, so I was going to present to you a little bit about the telemedicine updates, but we just heard about that. So I'm going to go ahead and move on to issues concerning chronic diseases during the legislative session. So two bills that I think that y'all should be or that you should be aware of is bills that were related to cancer care. But specifically, I mean, these can be related to a lot of chronic diseases that have issues with accessing medications for patients. So what we saw lawmakers immediately address was the issue of pharmacy benefit managers and also prior authorization. So these issues essentially, you know, they're complex healthcare policy issues. And during this past legislative session, you know, we saw lawmakers address the ongoing issues that we've seen with PBMs is what they're referred to. So PBMs are supposed to exist in order for less waste to be associated with the cost of medication and prescribing medications. But ultimately, PBMs have kind of become this sort of bad guy in the realm of healthcare, where PBMs are essentially increasing the cost of healthcare and delaying the access to medication for patients. For example, a cancer patient may be prescribed a specific type of medication, and because of their insurer working with a specific PBM, the PBM will have to then approve the prescription as it's filed with for dispensing, and then there may be delays in receiving that medication for the patient. In some instances, when we're specifically talking about patients with cancer, you know, unfortunately, it can be a delay that causes, you know, an untimely death, right? So PBMs and the issues concerning PBMs have been kind of on the rise and on the horizon for a lot of lawmakers who want to address these issues for important patient populations. It's not just cancer, it's also patients who receive HIV medications, patients who receive diabetic medications. It's a wide range of population. So HB 1763 really sought to address some of the issues that we're receiving with retroactive fees and medications being dispensed poorly, right? Another issue that I think is of importance, I think, for local pharmacists, if you are a pharmacist, was HB 1919. This essentially allowed for PBMs. One of the issues with PBMs is that they can specifically make it so that patients have to receive their medications from specific pharmacies that are, you know, owned by the PBMs. And HB 1919 essentially made it so that patients could go to local pharmacists and have the option to choose local pharmacies versus a pharmacy that the PBM decides is okay or approved under their, you know, guidance. This made it essentially easier, or in this instance, right after this bill was passed, it'll essentially make it easier for patients to receive their medications, work with local pharmacies, and also have their pharmacies, those local pharmacies, deliver their medications versus having to go with a PBM where it could, like I mentioned before, where they could experience delays. Another issue here with cancer care and dispensing medication, also of relevance to other chronic diseases, was the issue of the Texas Gold Card. So for prior authorizations are essentially an approval system for patients who are prescribed specific medications. Their providers have to go through an approval process called prior authorization. And through this process, then they're approved to receive the medication. Essentially, providers have to go through this in order to prevent abuse in prescriptions. We've seen within the past few years, there's a lot of issues with opioids, right, and poor prescriptions that were being given out. The issue with prior authorization has affected a lot of other patient populations, not just cancer care. I know that I worked previously on a bill that was related to prior authorization and HIV patients. The Texas Gold Card system allows for providers who have been prescribing medications responsibly and who have received essentially 90% of their previous prior authorization requests approved. It allows for them to essentially have less of a burden by having to go through prior authorization process, and then makes it easier for them to prescribe the medications that their patients are seeking. Now I'm going to go ahead and move on to Medicaid policy. So we know that over the past few years, we've seen a lot of issues pertaining to Medicaid really become of relevance to Texans, especially as we know that Texas still has a lot of uninsured folks who live in our state, right? Now, lawmakers, while they have been unwilling to really discuss the issue of Medicaid expansion, have been looking to other sort of winning ticket items that they might be able to address. Some of those issues include access to Medicaid for children in underserved communities, and access to Medicaid for pregnant women or people postpartum. So the two issues of main importance to a lot of proponents who were trying to address these issues, specifically postpartum issues, and then issues for children accessing healthcare in Texas, really honed in on these two pieces of legislation. They were really a driving factor for a lot of proponents of Medicaid expansion in the legislature, but we also saw a lot of bipartisan support for these two issues. So HB 133 really made it so that people postpartum after pregnancy were allowed to continue to stay on the Healthy Texas Women's Program for up to 6 months. Previously, it was about like 6 weeks. As we know, Texas has had really poor maternal mortality rates. And so Texas lawmakers looked at this issue as a winning issue to try to address those poor maternal mortality rates that we've been seeing in the state. And a lot of advocates were very happy to see this legislation pass. It unfortunately almost didn't pass, and it was really at the 11th hour that it passed. And we'll go into that a little bit later. The second bill here is HB 2658. And essentially what was happening here was that children on Texas Medicaid were falling off of Medicaid because of the multiple points in time in which children were required, or their guardians, their parents were required to submit their income levels and essentially prove that they're still eligible to be on Texas Medicaid for children. Now, because of HB 2658, the time period in which income checks are required is now 12 months. Previously, I believe it was like 6 months. And as we know, when you have a family that has access to Texas Medicaid for children, there are typically multiple kids within the household. And essentially this was affecting a lot of families because, they had to go through this process over and over again with the previous eligibility requirements. Now, I mentioned Texas Medicaid, right? And this being an issue, specifically Texas Medicaid expansion for the, Obamacare as it's deemed. Because this was a pandemic year, there was a lot of hope that there may be an opportunity for lawmakers to finally address Medicaid expansion, which would allow for a lot more people who are currently uninsured in the state of Texas to be able to gain access to healthcare insurance. So because of the pandemic, you saw actually for the first time about 9 Republican lawmakers in the House decide that they would support or back Medicaid expansion policy legislation that was being proposed in the House. There was a lot of controversy about this and a lot of whispers about what was going on. Essentially, because there were lawmakers who had signed on to a potential Medicaid expansion bill, the House GOP caucus, essentially, the leaders of the House GOP whipped their members into line and essentially said, hey, you better not support this policy because, XYZ might happen to you during the upcoming election cycle. We know that lawmakers were currently considering or previously considering redistricting and finalized redistricting. It was an opportune time to have really good threats if you had people who were falling out of line. So leadership took that into consideration and to their advantage and really defeated Medicaid expansion and the proposal that was on the floor to have this discussion. Unfortunately, that means that Medicaid expansion won't be passing anytime soon within the next few legislative sessions because, people who are against, lawmakers who are against Medicaid expansion will point to the numbers and say, look, there wasn't enough votes during the last legislative session. It's going to be politically unpopular if you go and move forward with this type of legislation. And if you do move forward, say that you want to move forward with this legislation as a Republican lawmaker, you're going to have a primary battle before you, right? And you have no ammunition to say that it's possible that we could have this kind of policy move forward within our state legislature because of the numbers, right? You also saw the controversies, and I'm sure you've heard about with new abortion restrictions. This is essentially deemed a fetal heartbeat bill, where, essentially at 6 weeks or after, if you are seeking an abortion, you're no longer eligible to have one in the state of Texas, essentially outlawing abortion in our state because most women find out that they're pregnant at 6 months. And so it's very highly controversial. It's currently being battled in court. It is the law of the land at this moment, but we'll see what ends up happening with this court battle. A lot of people see this as one of the things that are going to lead to a catalyst in the Supreme Court reviewing Roe v. Wade once more. Then we had gender affirming care and minors. Essentially, we had 2 transgender issues come up within the state legislature, one specific to healthcare providers and another specific to schools and athletics. The one related to healthcare providers essentially was trying to make it so that minors weren't able to seek mental health services, behavioral health services that might be related to gender affirming care. Essentially, people who are suicidal or who are, in this population who might be seeking, counseling or other behavioral health services. This bill that was proposed might have potentially prevented people from being able to seek out mental health services related to this. Also would have prohibited hormone blockers for individuals who are seeking that type of healthcare service. The other controversies you may have heard of during this legislative session were related to voting rights. And essentially here, it's been a controversy since the 2020 election when, former President Donald Trump had contested the election results. We've seen a lot of efforts to essentially make it harder to vote across all 50 states, not just Texas. And Texas ended up passing its own version of I think they called it voting integrity, those who were in support of this bill. But this is currently being challenged in court by the Justice Department. We'll see what ends up happening with this. As we know, as we hoped, lawmakers would address ERCOT and the issues with the electricity grid here in the state. Unfortunately, as we've just reviewed, there were a lot of other things that were prioritized. There was some legislation related to ERCOT and assuring that the members of ERCOT were, the board of ERCOT were Texans and living in Texas. But outside of that, there wasn't too much legislation that was passed related to ensuring that something like the winter freeze that we experienced this past year doesn't happen again. Lastly, and kind of segueing into the next piece that I have for you, a lot of what happened during this legislative session and the consecutive special sessions that happened after were things that took place because of the upcoming gubernatorial election that'll take place in 2022. And then after that, the presidential election that'll take place. And the reason for that is, Governor Abbott is up for re-election next year. And Governor Abbott is also seen as one of the potential nominees for the presidential election in 2024. And so a lot of what took place, while some would say it was very partisan, was partisan in nature because of the upcoming election year that we're about to go into. With that said, the last piece of the legislative session that I think we should discuss here is specifically to us, as we are a Hispanic and Latino community, was the issue of redistricting. So currently, the Texas House of Representatives has 33 Hispanic opportunity districts. When our state lawmakers decide the districts and the way that they are designed in order to essentially meet requirements, they design some districts so that they are opportunity districts for minorities. The largest minorities in our states, right, are Hispanic or African American and Black. And the breakdown here that you see before you is the breakdown of the population as it currently exists based off of the 2020 census, right? Of course, we know that the census is flawed even in a regular year, but the census, of course, was even more flawed during 2020 because of the pandemic and our inability to reach our populations to the extent that we would have been able to in a regular year. But as it stands, the numbers show that Hispanics and Latinos in Texas have essentially broken even with the white population in the state of Texas. I would also venture to say that the white population that is shown through the census is flawed in itself too. As we know, within our community, we have a lot of folks who mark themselves as white as they are filling out information regarding their demographics. So I would even venture to say that our population is probably far exceeded the numbers that you see here. But that is the numbers as they currently stand. What ended up happening as our lawmakers decided these congressional districts and the House districts and Senate districts for the state legislature, we saw Hispanics lose 3 seats in the state House. And we saw sort of similar things happen with the African American and Black community in the state. These are, concerning things, but they're also being battled in court right now, as much of the legislation that I previously discussed is. Unfortunately, Texas has a track record of doing things that have to be ultimately battled in court. But something that, I think a lot of people tend to ask me is, what can I do? How can I get involved to sort of stop some of these bad things from happening or to change the course of our state government? And, I'll just leave you with 2022 Texas election information. The election in Texas in 2022 is going to be on Tuesday, November 8th, 2022. That's the general election that happens during every year that we have an election. But remember that there are primary elections. A primary election, if you haven't participated or you don't participate, is where you decide who's going to represent you within your specific party prior to that general election, right? So during the springtime of 2022, you'll have the opportunity to vote either in the Republican or the Democratic primary. Within those primaries, you'll have your options for who is running to represent you specific to that party. Once that election is over, you'll have your candidates then who are going to be running for your general election in November of that same year. And then you'll have, the battle between the Republican and the Democrat. Whoever it was that you decided on during that primary election will be your candidates to vote for in the general election. That's kind of it. So hope this information was helpful to you. I'm happy to take any questions that y'all have or turn it back over to the moderator.
Thank you, James. That was definitely incredibly helpful. I appreciate it. I do not see any questions on our Q&A box, but I'm going to open it to the participants if they would like to ask a question right now. Don't forget, if you are not a member of NALHE yet, please go ahead. I think Stephen shared some information at the beginning, but we're happy to send that information over to you so you can be part of our organization and be part of these great events that are coming up. Okay, I think we do have a question. Let me read it for you. I'm here in Colorado. What is the appetite to expand emergency Medicaid? We recently passed a bill to expand it for end-stage renal disease for people who are undocumented.
So is that a question for me specifically or somebody else? Sorry.
Yeah, James, if you can take that.
Sure. So I do work in multi-state government relations. So Colorado is a state I will be working in. I do not currently have infrastructure in the state. And so I can't speak to whether or not that would be politically viable within the state legislature in Colorado. But I'd be happy to connect offline later. I shared my contact information, my contact card there within the chat. If you want to stay in touch with me, please feel free to click on that link. You'll get access to my email, my LinkedIn, my cell phone number.
Thank you, James. We got another question. I was wondering about the appetite for it in Texas specifically.
Oh, in Texas. So can you repeat the specific policy? I know it's emergency.
Yeah, no problem. What is the appetite to expand emergency Medicaid?
And it was for, what was it? There was a precursor, right?
Correct. It is for the end-stage renal disease for people who are undocumented.
Yeah. Unfortunately, the appetite for any sort of access to medications or healthcare for undocumented people in the state of Texas is not there. Texas lawmakers are not interested in providing healthcare to people who are undocumented. But with that, there's a caveat. So first, that unfortunately will not be happening within the state legislature anytime soon. Any sort of healthcare measures related to undocumented people. Why is that? Because it's politically unpopular for the Texas Republican Party and anyone who is a lawmaker in the Texas Republican Party based off of their party platform and the people who vote within that primary, as I mentioned. Of course, if you are a Texas Republican, you should be involved in the conversations that are happening within the party. You should be voting within your primary election, and you should be contacting your lawmakers as they are candidates during the election cycle. Without your frequent communication to them, they're hearing the loudest voices in the room, right? And the loudest voices in the room right now are not in the Republican Party, are not for this type of service that we're talking about. The caveat that I was mentioning earlier, so while there won't be any effort to allow for people who are undocumented to access Texas Medicaid in any way, there are throughout the state and throughout the country. So no matter where you're at, always remember that federally qualified health centers and the systems that are federally qualified health center systems, they are by law, by federal law, required to see anyone regardless of ability to pay, regardless of insurance status, and regardless of their citizenship status. So if we're talking about something that is preventable, if we're talking about something that is addressing something in the short term, definitely make sure that you or your friends, family, patients know that they can always count on an FQHC. But when we're talking about something that's end of life care, unfortunately, I'm not aware of access that is accessible for undocumented people at this time.
Thank you, James. I appreciate everybody's time tonight, and our speakers, of course, giving us information on these topics that we definitely need to be updated, and everybody from NALHE that was able to participate tonight. Please don't forget, I think Alex put on the chat, don't forget our information about our next event in December, be in the outlook for that, and have a great evening, everyone.
Bye all.
Thank you.